Hey everyone, my name is Allison Casey. I'm an associate marriage and family therapist here at Embracing New Therapy. I wanted to take some time to talk about Obsessive Compulsive Disorder, otherwise known as OCD. There's a common misconception out there that if a person is meticulously organized or they really enjoy keeping things pristine clean, they must have OCD. Oftentimes you'll hear it referred to as a joke even, but this isn't the case. So let's use a quick example to actually describe what OCD is. Say we're all leaving our homes. Super normal for us to close the door, lock it, maybe we'll double check, and then we go on about our day. But what if we feel compelled to check a third time or to check a fourth? Now we're talking about an obsession. We're talking about a fear. What if I didn't lock my door? What if I didn't lock my door and someone breaks in? So then we go into rituals, which will then be a compulsion. It would be step 1, close my door. Step 2, put a key in the knob. Step 3, turn the key. Step 4, check a certain number of times to make sure that the door is closed. Step 5, take key out. Step 6, even pull on the door to make sure that it is closed. This is just one of those scenarios. A small, simple example of what someone that does have OCD could be going through. And I wanted to touch on it and bring light to it because OCD is a specific type of anxiety disorder that is characterized by obsessions and by compulsions. So obsessions are recurrent, intrusive thoughts that are unwanted, and they lead to anxiety. They lead to uncertainty of fear. That then, like I mentioned earlier, triggers a compulsion. Compulsions are the actions, both mentally and behaviorally, that are directly associated to that obsession. So going back to locking your door, it's what if I didn't lock my door and someone comes in and breaks in and steals everything? So the compulsion is, I need to quadruple check. I need to do this ritual in order to ensure that nothing will happen and reduce my anxiety, reduce my fear. So with OCD, it can be, specifically with compulsions, it can be very time consuming. Not only will the person feel anxiety and stress, a lot of times it can be isolating. People may not realize the full extent or gravity of the emotional turmoil that people feel inside. And that's something that here in the work that we do at Embracing New Therapy, we bring that up. We talk about it. We identify what are your obsessions, what are the compulsions. We'll even do some ERP. There's a lot that can be done, and my purpose of putting this video out is to just bring awareness on what OCD is. If anyone has any questions, please feel free to leave them on the comment box down below. If you feel inclined to as well, you're more than welcome. Please give us a call. Set up a consultation and we'd be more than happy to talk to you about OCD and potentially schedule a session.